I had a conversation with a doctor recently, not in a professional environment, it was a social environment, and we were just having a conversation about his work and my work, and we were talking about health and medication and nutrition and the sort of the medical health industry, broadly speaking. And I was horrified when he said to me that he prescribes medication and recommends surgical procedures for things that he knows very well can be solved with lifestyle changes, with nutrition, with exercise, with sleep, with all those things that we talk about on this channel. Yes, he knows that those are solutions to most health problems, especially all the metabolic problems that people have, but he doesn't discuss them with his patients, even though he knows it works, and he told me why. Welcome to ShapeFixer. I'm Andrew. I'm a nutritionist. I'm a sportsman. I do prefer to approach health through nutrition and lifestyle and habits before we resort to medications and surgical procedures, because I just think the natural way, if you can do it, is so much better for your long-term health. And every Wednesday I do a video called WTF Wednesday because something's really annoyed me, and this conversation with this doctor really annoyed me. And the reason or the explanation that he gave was that patients are lazy. He implied his patients are stupid, and he knows that they will not listen, they will not change their lifestyle, they will not eat well, they will not get off their backsides and go and exercise, and therefore he believes it's a waste of time him talking to them about nutrition and lifestyle and exercise, and he goes for the short option, the easy option, give them some more pills, get them addicted to some more medication, recommend some procedures, and hey, guess what? Which he didn't say, is there's money in this. Now, it may be that some patients are going to not listen and don't want to take responsibility and don't have the self-discipline to exercise or avoid the harmful food or cut down on, I don't know, smoking or whatever. Of course, there are people like that. That doesn't mean you don't share that information with them. Surely he has a responsibility to at least make sure that they understand these things and that he has explained them to them himself, because that is a duty of care, I would have thought, that ties in with the Hippocratic oath of doing no harm. It's not going to be all the patients. There are always going to be some who desperately want the information, desperately want the advice, desperately want to be able to heal themselves and be healthier without spending a whole lot of money on medication, without taking medications with potentially deleterious side effects, and without having to go for surgery. So, WTF, what is going on here? If you have a doctor who does not want to even discuss those alternatives with you, then you don't have a doctor, you have a drug dealer, and you need to find another doctor. And if the system that you're living in does not facilitate you having another doctor because that doctor has been assigned to you, then you owe it to yourself somehow to get as educated as you can, at least about your personal conditions, so that you have a better chance of making the right decisions and taking charge of your own health, which is where channels like this come in, and there are others out there. This is really going to be on you if you have a doctor like the one that I met recently. That is my what the F moment for this week is, and it's not all doctors, but unfortunately it's too many that do not allow the patient to take responsibility. I met another doctor a few months ago who got quite annoyed at the idea of patients wanting to discuss options and pushing back and challenging his diagnosis or challenging his prescriptions, saying, I'm the doctor, I'm the one who knows what I'm talking about, you're just the patient. If you don't want to do what I say, go away and find another doctor. And I say that is the best advice that he has given his patients. Go and find another doctor. Thank you for subscribing to this channel. Please do that. Not all my videos are rants. Okay, that's only on a Wednesday. Most of my videos are really considered and educational, and you will find something on my channel that will help you with whatever your metabolic issue is. And if it doesn't help you fix it, at least it helps you have a conversation with a doctor, so long as you have the right doctor who will talk to you.